So Dr. Nikita Vizniak here with Daniel, and we're going to go through and do an assessment form, a real patient visit. This will be for educational purpose as well as him figuring out what's going on and maybe giving him some recommendations. So a couple of things to realize, how I would work with a real patient in practice. He is a real patient. I believe he's really here. But I will be talking through some of the processes that I might not talk through with most patients. So when we're going through here, I'll be explaining some things. I know he's game for it because he wants to learn as much as he can through it. So yeah, just made a joke here really first of all to start with, looking at the patient intake form, and we've got marital status left blank. A little bit awkward. Okay, yeah. All right, anyways, moving on. So Daniel, what is the main thing that you want to have evaluated here today?
My lower back.
Okay, your lower back.
Yeah. And then my body was like relatively limp, and then I just got jolted from behind.
So you took the lacrosse right across the stick, right across the back,
I'm not sure really where I got hit, but I just know it was somewhere on the back.
All right, on a scale from 0 to 10, when you first noticed it, when you couldn't move, what would you say it was?
It was like a 9.5.
Okay.
I broke my sternum, and it wasn't as bad as that.
Okay, that's a good one. Okay, I broke my sternum, and it wasn't as bad as that.
Yeah.
All right, that's a good one.
Just to relieve the pain.
Yeah. Okay, so that's a position right there that makes it feel better?
Yeah, just kind of relieves it. I also have a lot of tightness in my knee that it feels like it releases when I do that, and then it just kind of...
Okay, so this is a key thing for you to get. I say this all the time, but if you're looking at patients tell you how to treat them. What we saw Daniel just do right there is one of the mechanisms that we're going to look at as part of our assessment, right? All right, so here we are back again. So just recap on the history here. So we've got Daniel, lacrosse player, fairly hard cross-check that happened about a year ago, low back pain. Just summarizing what we're going through on the history. Tightness that you feel all the way down on this side, starts above the iliac crest, over top of the hip, around the outside of your knee. Mm-hmm. Goals are, number one, figure out what is exactly going on here. Number two, how can I correct this issue? Mm-hmm. What aggravates the symptoms are prolonged sitting, or if you do a heavier back day where you feel yourself doing like a deadlift or anything like that, where you're pulling the weights up. And it feels better if you move your body around a little bit. Yep. Otherwise, Daniel's got no real risk factors in his history. There was an x-ray taken following the injury that didn't show anything of significance. Mm-hmm. He's got a good diet and good exercise level, and it looks like he has a fairly good outlook on life, so we'll go ahead and continue our way through the exam. So, where I like to go through from here is just get a baseline of function, some active range of motion, and because this is a lower extremity kinetic chain, we're going to do a couple of key actions. The first action I always like to do is just going to be a simple squat and rise, and I just want to see how you squat. So I'll have you turn facing me, and you're going to stand like this, and we're both going to go down, all the way down as far as you can. Okay? All right, and then coming back up, and let me see that action again. Okay, kind of an interesting thing, he's got right-sided issues that he's dealing with. When he's coming down, what I can see when he comes down on his right side, and I'm mirroring this. I know this is my left side, okay? But he comes down, and I can see this knee does a little bit of a wobble, right? Your left knee looks like it's excellent all the way through. Let's go ahead and spin you 90 degrees, so you're facing the camera, and go ahead and repeat that same action if we can. Yeah, so you can see that. You can see that now too, right? I guess you should back up even just a little bit, otherwise we're going to go bump into it. Okay. All right, so you're going to go down as far as you can, all the way through there, and then come on back up. Let's have you lean back as far as you can. And how do those feel?
I can feel it.
Okay. When you say you can feel it, how do you feel it?
It's just kind of, I don't know, it feels like I'm putting pressure on it, and then it kind of appears.
Okay. How does it feel when you bend forward?
It feels good. It feels like it's stretching.
Okay.
Releasing.
Yeah. So he's already telling me how to treat him, right? Like you feel better with a flexion type movement. You feel worse with an extension movement that compresses in. Yeah. Okay. My general assessment, I always like to do things weight bearing to start with because this is how you're going to play sport. This is how you're going to be most of the day. This is what.
Yeah, 17 minutes. Good.
All right, so same thing as before. Anything's painful and comfortable, let me know right away. So this is going to be just a basic stretch, straight leg raise, and we're going to see what your flexibility is like here too. So take this leg first, and just let me lift it up. Just a nice heavy leg, all the way up. Yep, and that's pretty much an athletic. That's an athletic leg right there. Okay, so you get about that much range, and you feel a little bit of stretch. Does that aggravate your symptoms at all?
No.
No, it doesn't change it. But you can just feel the tightness that you have, right? You can have your partner do it. That would be the best thing right there. Okay. All right, there's a couple of things right there. So first of all, what I would be doing typically when I'm working with a patient is we're going to go ahead and cycle through just our evaluation. I would be talking to you like that, but because we're doing this as more of an educational opportunity, I'm going to list off the stuff that I'm palpating as I do it. So to start with, we're just checking the erector spinae, just getting used to contact. I'm starting away from the area of injury just to see what his body feels like in other areas that might not be so damaged, okay? Or have specific injuries in that region. So erector spinae, ribs, intercostals, all that's being evaluated right here, sinking into the area of the QL. And we got a little grunt. Yeah? No? Where did that hurt? Right about there?
Yeah. Yeah, when you push on the left side, I can feel it on my right side.
Okay, so that's an interesting finding right there. When I push on the left, he feels it on the right. Okay, there's been some interesting crossover that he's got. Now I'm coming down to his SI joints. So I'm on his PSIS here. How does that feel on your right?
It feels fine. I mean, that relieves it a little bit, kind of.
Whoa, whoa! Okay, he's got to say that louder for everybody.
Relieves it.
It relieves it a little bit when I push on his right SI joint. Okay, let's go over to your left SI joint.
Yeah, nothing.
Nothing really changes. But interestingly enough, when I spring it on his right, there's a nice springing action, good movement right there. When I spring it on his left, that is a tight SI joint right there. Now I have to say a couple of things here. First thing is, I'd like to do some adjusting in some soft tissue, like massage over top of this area. There are alternatives to this. You could actually have acupuncture done, wouldn't be a bad choice right here. Okay, you could actually potentially just watch and wait and see what happens, but I think you're already past that point. You want to see something done with this. The risks associated with this, you could see, would be maybe a mild sprain that's going to occur. You could be a little bit sore following it. The other thing that I would caution you on is if you have this kind of work done, I wouldn't go and lift heavy the next day or right after it. Okay? Yeah. You know you're in the right place when the patient goes, oh yeah. Okay? Oh yeah. Okay? So again, what should you be thinking as the doctor or therapist? You need to think, what are all the tissues below my contact there that I'm actually working through? I'm superficial over the Erector Spinae, and then I'm sinking a little bit deeper through them. I'm getting into right next to his spinous processes here, into that transversal spinalis muscle group. Okay. All the way out, out and go. Yeah, good. And you could feel it actually released a little bit on setup, and then you could feel it move again, right? So, okay, same thing flipping over this way. So SI tight on that side. I'm actually going to stay away from this SI joint on him right now. I just want to see how he does with that. One of my biggest pet peeves I see from so many practitioners is all the way through the body, you don't know what you're actually doing is making the therapeutic benefit. I am looking for the minimal effective dose. What's the least I have to do to help get this guy better? If you overtreat, overtreatment can be as bad as undertreatment. So you want to make sure you find a balance within those, and everybody's a little bit different, so you experiment with each patient. Let's have you squat again, just to the side like that. Boom. Look at how his movement pattern has changed. You don't see the wobble in the knee, okay? A little bit there at the end, but it wasn't too bad. There was a little bit where you dropped in a little bit. What I want people to do in their own practices when you're doing this is assess, treat, reassess, and see if you've made a difference. Movement patterns are the way you can tell if this has happened. That's the start of the difference that you want to see in a patient right there. Other options that you have is we can start getting into more, I know we're just pressed for time right here, but your leg's just going to sit like that. This hand can just hold yourself on the table so you're not going to move. This is one that the Jets love doing. So the Winnipeg Jets, when I was out there with them, one of the big ones that they like to do is they like to take and pin, yeah, just like this, next to no force, pin, and start to move the leg around as we're going through here. They do this with their players all the time. One of the best, yeah, stay with me, man. Okay, so something like this. Okay, so you can feel right away, like we're right into glute med, and you can just tell we got to work through this area a little bit more.
Okay.
I don't want to beat them up all in the first visit though, right? So that's where you're going to start.
Gotcha.
Okay? Cool. So yeah, so you've got a bunch of stuff you can work on. You've got some tissue-specific identification, and away we go from there.
Cool. Thank you very much.
Okay.